Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about multiple myeloma. In particular, I will cover what it is, how you treat it, and how you can better live with multiple myeloma. So we start with what it is. In multiple myeloma, a group of abnormal plasma cells, myeloma cells, multiplies, raising the number of plasma cells to a higher than normal level. Since these cells normally make proteins, the level of abnormal proteins in your blood also may go up. Health problems caused by multiple myeloma can affect your bones, immune system, kidneys, and red blood cell count. Myeloma is the second most common cancer of the blood. In Ireland, on average, approximately 187 new patients are diagnosed with myeloma each year. Myeloma is more common in men than women, and the incidence increases with age. So the signs and symptoms of multiple myeloma can vary from person to person. Although the condition may not cause symptoms early in the disease, it's likely that you'll experience one or more of the following as the disease progresses. Bone pain, particularly in your back, pelvis, ribs and skull. Presence of abnormal proteins, which can be produced by myeloma cells in your blood or urine. These proteins, which are antibodies or parts of antibodies, are called monoclonal or M proteins. High level of calcium in your blood. This can occur when calcium from affected bones dissolves into your blood. If you have a high calcium level in your blood, you may experience signs and symptoms such as excessive thirst and urination, constipation, nausea, loss of appetite, and mental confusion. Other signs and symptoms of multiple myeloma include anemia-related fatigue, as myeloma cells replace oxygen-carrying red blood cells in your bone marrow, unexplained bone fractures, repeated infections such as pneumonia, sinusitis, bladder or kidney infections, weight loss, weakness or numbness in your legs. The exact cause of myeloma is not known, but the condition begins with one abnormal plasma cell in your bone marrow, which then multiplies uncontrollably. Most people who develop multiple myeloma have no clearly identifiable risk factors for the disease. Some factors that may increase your risk of myeloma include your age. The majority of people who develop multiple myeloma are older than 50, with most diagnosed in their mid-60s. Few cases occur in people younger than 40. And your sex, men are more likely to develop the disease than women. And also your ethnic background. Black people are about twice as likely to develop multiple myeloma as white people. And also obesity. Your risk of multiple myeloma is increased if you're overweight or obese. Other factors that may increase your risk of developing multiple myeloma include exposure to radiation and working in petroleum-related industries. And so next is, how do you treat multiple myeloma? If you're experiencing symptoms, treatment can help relieve pain, control complications of the disease, stabilize your condition, and slow the progress of the disease. Standard treatments for myeloma. So there is no cure for multiple myeloma. With good treatment, results can usually return to near normal activity. You may wish to consider approved clinical trials as an option. Standard treatment options include Velcade. Velcade is administered intravenously. It causes cancer cells to die. It is approved for people with newly diagnosed and previously treated myeloma. Also thalidomide. Today, thalidomide is approved for the treatment of newly diagnosed multiple myeloma, and this drug is given orally. And Revlimid. Revlimid is similar to thalidomide, but because it appears to be more potent and cause fewer side effects, it is currently used more often than thalidomide, and it's also given orally. And chemotherapy. Chemotherapy involves using medicines taken orally as a tablet or given through intravenously to kill myeloma cells. Chemotherapy is often given in cycles over a period of months, followed by a rest period. Corticosteroids. So corticosteroids such as prednisolone and dexamethasone have been used for decades to treat multiple myeloma. And stem cell transplantation. After treatment, a stem cell transplant may be necessary. This treatment involves using high-dose chemotherapy along with transfusions from previously collected immature blood cells or stem cells to replace diseased or damaged marrow. Radiation therapy. This treatment uses high-energy penetrating waves to damage myeloma cells and stop their growth. And finally, how do you live with multiple myeloma? The following tips may help you to keep multiple myeloma under control. You stay active. Exercise helps keep your bones stronger. If pain keeps you from being active, ask your doctor about ways to lessen the pain. Drink fluids. Drinking plenty of fluids can help keep you from becoming dehydrated. And by drinking fluids, you help dilute the protein fragments in your urine, which may help prevent kidney damage. Eat a balanced diet. One way to promote your overall health and cope with any form of cancer is to eat well. The amount of protein in your system isn't affected by how much protein you eat, so there's no need to limit protein intake unless told otherwise by a doctor. De-stressing. Stress is not good. It may be the case that living with multiple myeloma is the thing that is causing you to be stressed in the first place, but you have a lot more control than you might think. In fact, the simple realization that you're in control of your life is the foundation of stress management. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing multiple myeloma more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as an exercise ball, floor mats, weights, and various other items to get you up and running on a program that we create together and is specifically tailored to you. We also have various supplements and products which you can purchase from us without prescription, such as lavender oil. We also stock light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing multiple myeloma with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.